Today, we're here to talk about healthcare and retirement. And that's really because healthcare is going to be one of the biggest expenses that people face in retirement. According to the annual Fidelity Retiree Healthcare Cost Estimate that was done in 2023, a typical couple age 65 who retire will be facing $315,000 worth of total healthcare costs during retirement. And those costs don't include their long-term care costs, their over-the-counter medications, or their dental services. Hi, I'm Sally Boyle, founder of S.J. Boyle Wealth Planning, and we work with individuals and families who are 10 to 15 years away from retirement. And this survey supported our mantra, which is you can't plan early enough for your retirement. So you'll see why in a few minutes. Let's just go through our healthcare options in retirement. I think most of us are familiar with Medicare, and I think that's what we expect will be the core coverage, and that's true. But for those who retire before age 65, they've got some considerations as well. And there are three options that they probably should consider. And the first is their employer benefit. Employer benefits, medical benefits are portable. They can take it with them under the COBRA provision, COBRA, and they can speak to their HR department to see exactly what that cost will be for them to take their healthcare into their pre-Medicare years. And they should expect that it's going to be more expensive because they'll be paying for the employer premium as well. If the employer has subsidized the premium during their working years, they'll be paying that portion. And they should compare that then to other coverage options, which are private insurance carriers. You can go to the individual marketplace with a private insurance carrier, and the ACA marketplace, which is your state-run options that are available through the ACA programs. And take into consideration their income to see if there's any subsidies for their state-run benefits, and compare those three to determine which might be the most cost-effective given what they need in terms of their coverages. But once you reach age 65, of course, Medicare will be your core coverage because, as we know, Part A is the one that we've paid into during our working years. And Part A covers our hospital stays and procedures and inpatient hospital procedures. It has a deductible of about $1,632, at least in 2024. And it will be supplemented by Part B. And Part B covers our doctor visits, anything that's not hospital related, doctor visits, outpatient treatments. And this is one where we will be paying a premium. It will probably come out of your Social Security check if you're taking Social Security, or you'll be paying it individually if you're delaying Social Security. And the premium, at least for 2024, the base premium is $174.70. The Part B annual deductible is $240. And so when you put that together with your deductible for Part A, you could be looking at about $1,900 in total deductibles. Now, what rounds out the coverage is Part D, which is the prescription drug plan. And that's a plan that varies by income. And when we look at the average basic 2024 premium for Part D coverage, it's estimated to be about $55.50. So we put together those three coverages, Part A, Part B, and Part D, and that gives us our hospital, our standard medical treatment, as well as our prescription drug. But we'll also be looking to add some supplemental coverage for Medicare limits, for Medicare deductibles. We can get supplemental coverage that will help pay for that, help subsidize our hospital stays and other expenses that aren't covered by Medicare. Supplemental plans follow a very specific schedule, and there's a number of them that you can consider, anywhere from F through N, I think. And there will be a variety of coverages and premiums. And so what you have to do is look at your medical health history and see which one seems to suit your needs best, whether it's to have a more comprehensive coverage with a higher premium or a more base coverage with a lower premium and a higher deductible. So it's usually good to work with a specialist who could also help you with your Part D coverage, because all of those have varied premiums based on what your needs are and what your health history is. So working with a specialist to give you some guidance on the supplemental coverage as well as the Part D coverage makes sense. So those will be your core coverages. But we'll also find that the premiums are a cost to us, as well as those things that fall even outside of our supplemental coverage in Part A and B. And this is where planning ahead makes a big difference, because we have the opportunity to save into a health savings account. It is like an IRA that subsidizes our medical expenses. And if you're not yet rolled in Medicare, still employed, still working, you can save money in these HSAs, and they can be used to pay for your Medicare premiums, your long-term care premiums, and other medical expenses that you and your family incur prior to retirement, but especially in retirement as well. You can contribute to them if you're in a high deductible health plan. Most employers offer a high deductible health plan. And the HSA is almost the perfect investment because it's deductible. The contributions are deductible. The growth in the plan is deductible. You can use underlying investments that are very much like the investments that you use in your IRAs. And if you use them for qualified medical expenses, any withdrawal is tax-free. So it's tax deductible, tax-free growth, and tax-free withdrawals if used for medical expenses. Now, the deduction limit for an individual in 2024 is going to be $4,150, and for families, $8,300. And these limits will apply to both your contribution as well as your employer's contribution, because the employer can also contribute to an HSA for their employees, and many do, to encourage them to use their high deductible health plans. Those who are already in their 50s, approaching retirement within 15 years of retirement, can also use catch-up contributions of $1,000 per year so that they can contribute as much as $4,150. And HSAs can be used for a lot of things: reimbursements for private screenings, for mammograms, for annual physicals, for those things that might be outside of what's paid for in Medicare coverage. Another large gap in Medicare coverage is paying for long-term care. And let me define that if I can. Long-term care occurs when you can't take care of yourself, when you can't perform some of the daily living requirements. It can be preparing meals. It can be feeding yourself. It can be bathing yourself. You might have continence issues. You may have mobility issues. You may be unable to dress yourself, just basic life functions. It's also long-term care also is when we've lost our cognitive functions, Alzheimer's, those kinds of declines. And the numbers support the idea that 70% of us will require some sort of assistance as we age. And Medicare won't cover this. Medicare will only cover assistance facilities if it follows a hospitalization. So if what has happened is our care is as a result of a slow decline, then Medicare will not cover any of the facility options that might be necessary or any at-home care that we might need. So how do we pay for it? How do we do that? And this is, again, where thinking ahead, looking forward is really kind of important, because we have to plan for this. And many feel comfortable that they can self-insure, and that is for the families that have resources like that, they can. If they have somewhere between $200,000 and $500,000, because care in a facility on average for men and women, men are a little shorter, 2.5 years, women 4 years. You can expect that you're going to be looking at anywhere from $70,000 to $120,000 in this region, in the New Hampshire region. It's always good to look in your own regions, because different regions will have different costs. But if you have the ability to self-insure for a couple, you have that sort of discretionary cash. It takes into consideration because when you think of all of your retirement assets, setting some aside for this consideration probably does make sense. Another thing that you can do is you can purchase some long-term care insurance. And again, this is when looking a little bit forward makes sense, because if you don't anticipate, or you just choose that you don't want to use your resources to self-insure, then taking a look at an individual policy can make some sense. And the younger you buy it, the lower the premium. So if you start to look in your 50s, you'll understand and probably see the most cost-effective premiums available to you. This type of policy can pay a monthly benefit toward long-term care for a facility. It can pay a daily benefit towards home health care. And the benefits usually are between 2 to 5 years, and it can be lifetime. Those typically are not cost effective. And long-term care premiums may be affordable if you're looking into it at a younger age, but if you wait until an older age, there are hybrid life insurance contracts that will also support long-term care. And what we're seeing is a lot of people are taking their permanent insurance that maybe they've held over the years, taken the cash values, made deposits into these hybrid policies to buy a more affordable approach to long-term care than an individual long-term care policy. So if you have an insurance specialist that can show you compare the cost of an individual policy to a hybrid life insurance policy, you have life insurance where you have cash value accumulations, that can really be a good option for you to consider. And talking to an insurance specialist certainly makes sense. I guess the bottom line is healthcare spending can account for a large share of our retirement budget. And estimating these costs and creating a strategy for spending can help preserve more of your retirement assets for other things that you would like to do. There are other strategies that you can use to offset insurance costs. There are prescription drug programs that you can take advantage of, drug discounts. Pharmaceutical companies offer discounts in drugs that a lot of their retirees may be using. Local pharmacists offer discounts to senior citizens who need help to afford to pay for their prescription drugs or can't afford full price. There are discount prescription drug programs such as GoodRx that provide substantial savings. There are local municipalities that may offer discounts to their residents. For example, New York State provides an income-based prescription discount card available online from a city, town, or city government. The state also offers discounts for everyone, regardless of income, and the savings, if you're willing to take generic coverages, or even if there's a brand name, there may be a discount for that. So You can use things outside of your prescription drug coverage to address some of those costs. So looking at your local assistance can be of help. And then always being certain to review your medical bills to be sure that your costs are displayed correctly, that you're billed correctly, and that you don't have any unnecessary or unexpected costs. We find that especially when we seek help in the emergency rooms, that we get some very unexpected and sometimes unnecessary costs. So if you come across any of that you may challenge it. I guess the final thing to think about is all Medicare premiums are not the same. As we said, your Part D coverage is income related, and so is the premium for Medicare Part B. If you make more than $91,000, it's $95,000. You will pay something called an IRMA surcharge, and they go all the way up to $500 depending upon your income level. So working to minimize your taxable income will also help you reduce your Medicare premiums. For example, distributions from Roth IRAs, having Roth IRAs available to you in addition to your pre-tax IRAs, and planning for those incomes, distributions properly to try to keep your income below these IRMA brackets. That can help. Distributions from an HSA account to pay for your premium will not be considered in your income for IRMA purposes. Cash value life insurance distributions don't count in the Medicare formula that determines the final amount of your Part B premium. So that can be helpful. Income from a reverse mortgage doesn't count either. So you can often offset your healthcare income premiums by planning your retirement income and the sources of those income. It can really be helpful. So again, planning far in advance, I think, is advisable when we're considering healthcare and planning for our healthcare and retirement. And if we can be of any help to you, of course, SJ Boyle Wealth Planning would love to help you plan towards your healthcare and retirement. Happy retire.